Wonderful. Hello, everyone, and thank you for joining us today for the Cancer Conversations, a community discussion on melanoma awareness and prevention. I'm Manala Badi. I'm a senior program coordinator here with Mayo Clinic in Minnesota. Along with me is Nicole Landa, who is a community engagement coordinator with our Mayo Clinic, Florida, as well as Dr. Colin Costello, who's a dermatologist at Mayo Clinic, Arizona. We are grateful for the chance to bring this information to you today, and we'd like to thank Autumn Kappes with the Rochester Swim Club and Lolita Thomas with the Family Life Center for collaborating with us. Thank you so much for being here, and we will hear from all of our panelists here soon. Mayo Clinic's Cancer Conversation series is designed to bring physicians, researchers, and communities together to share and learn more about various types of cancer, their signs and symptoms, treatment, and resources. We will also hear directly from a melanoma cancer survivor, Autumn Kappes, who will share her unique health journey. These conversations are designed to educate and empower all of us to know health risks, get screening as soon as we can, and to take our health seriously. All right, so please take a moment to review our agenda for today, and we'll get started here in a minute or so. As you can see, today we have an engaging program for you, so please take notes and ask lots of questions. We will have a survivor story, a presentation on melanoma by Dr. Colin Costello, and a panel discussion highlighting our upcoming cool interventions in Minnesota and Florida. We have a survey to measure your knowledge before and after the presentation, so please take time to complete the pre-survey now. You can either scan the QR code that's up on screen or use the link that's going to be provided in the chat to take the survey. Again, welcome to anyone joining us. Please take a moment to scan the QR code on screen to take the survey, or you can use the link in the chat. All right, as we work through those surveys, we'll go ahead and get started. Our first speaker is Autumn Kappes from the Rochester Swim Club, and she'll be sharing her survivor story with us today. Welcome, Autumn.
Thank you for having me. My name is Autumn Kappes. I am the executive director of the Rochester Swim Club. I live in Rochester, Minnesota currently. My journey began when I grew up in Wisconsin, a family of fair-skinned redheads, blondies, and my last pediatrician appointment before I went to college, my pediatrician had noticed a scabby, kind of a discolored mole on the center of my back. And of course, that's a spot where, as a kid, you can't reach when you're outside. And we had a pool growing up, so we were outside a lot of times. We saw that went to the dermatologist, and they took a sample. And because I was 18 at the time, I went to that appointment with by myself. I was 18. I didn't have to have my mom and dad go with me. And I was told I had malignant melanoma. I had no idea what that was. Went home, called my parents. My parents came home. Back in that day, we had to look it up in the encyclopedia to find out what it was. And of course, you see cancer, and it's terrifying and scary. I had that mole removed, and I had one surgery after that to remove a bigger margin. I was fortunate enough to have no follow-up treatment, just my dermatology visits. And that started my journey of going to the dermatologist every 2 to 3 months. Every now and then I get to a 6 month point, and I just have to go 6 months, and it seems like something comes up again. And so I have to very carefully watch all that I do. 4 years after that initial treatment, I had a small spot under one of my eyes. I had to have Mohs surgery. That was done at Freighter in Milwaukee. And they took you right from Mohs surgery to plastic surgery to get that all squared away. I've had several small removals around my ears, my neck, on my arms. And then here in Rochester, I had one larger area on my forehead, about the size of a quarter, taken.
I think, Autumn, you're muted.
Yeah, it went on. There it goes. So I've had one surgery here in Rochester, and that went well again. I had to have about a quarter of size removed, and I did not have to have any treatment, just a wider incision and removal. And as fate would have it, I ended up in Rochester here working at an outdoor pool in the sun all the time. And so I am making my message, and helping to keep all the lifeguards safe, all the patrons safe. And that's where I met Manal.
Thank you, Autumn, for sharing your story. It's been such a pleasure to work alongside you in increasing awareness for melanoma.
Thank you.
I would like to open it up to our audience for any questions. If you do have a question, please place it in our chat box, and Autumn would be more than happy to answer your questions. I'm not seeing any questions, but if anything pops up as you're going through the presentation, please feel free to put that in the Q&A box, and our online moderator will make sure that your questions get answered. At this time, we'd like to transition to our educational presentation on melanoma that will be presented by Dr. Colin Costello, who is a dermatologist physician located in Mayo Clinic, Arizona. And I do see that there is a question. So maybe before we transfer to that, Adam, would you mind answering the question in the chat on how fast did the moles grow?
Oh, good question. I've always had, freckles and moles around, so I'm constantly getting them checked. But this particular, my original one, must have popped up at some time during my childhood and just was in a weird space. I would say the one that I had the most surgery on, I noticed it pretty quickly, just a little bump, but I really take a look at what everything, on my body all the time, just for any lumps, bumps, anything. So I'm pretty good at spotting one that I think is strange.
Any other questions for Adam? And you will have to use the question and answer box since this is a webinar. We do have another question, Adam. How often do you get your skin checked now?
Right now I'm in my 6-month phase, so every 6 months, and I stay at the 6 months until something were to come up. But right now I'm on my 6 month. I have gotten to a year a couple times, but I'm at 6 month right now.
And Adam, has it always been 6 months? I think I heard you reference that at certain points it's been sooner.
Yeah, at some points, usually right after I've had a surgery, I come back every 3 months. And then if that goes well, then we go to the 6 months and then possibly a year. But I've most of the 20 years now, it's been actually 30 years now, it's been really just either 3 months or 6 months. Most of the time, 6 months, but there have been some times where it's 3 months.
Perfect. Thank you for sharing that, Adam. If you have any other questions, oh, I see another one. What are your at-home preventative measures or treatments now?
Sunscreen every day, all winter long, and in the summer, more sunscreen than typical, quite often throughout the day. Lots of hats. My children always have to have sunscreen and hats, whether they like it or not. But it's just part of our family history, and we do a lot with the sunscreen. More than anything, I do also have shirts if I know I'm going to be out an extended period of time that are the UVA proof shirts. So those work really nice as well.
All right. Thank you so much, Adam. If any other questions pop up, we'll make sure to turn it over to you to answer those. Again, we'll go ahead and transfer to Dr. Colin Costello's presentation on melanoma at this time. Welcome, Dr. Costello.
Thanks, Manal, so much for the opportunity to present here today. And thanks so much for taking the time to present your story. Let me go ahead and swap displays here. Manal, does this display look appropriate now?
Yes, it looks perfect. Thank you.
Perfect. And to start things off, I just wanted to get some disclosures out of the way. I do have research support from Merck as well as DeepX Health, and all photographs in this presentation are Mayo Clinic patients who are permitted the use of these photos for educational purposes. While we'll discuss melanoma the majority of this talk, since May is Skin Cancer Month, I figured we'd touch for a short period of time on basal cell and squamous cell carcinoma as well. So 3 common types of skin cancer. Basal cell carcinoma is the most common type of skin cancer in non-Hispanic whites, Latino, Hispanics, and Asian patients. Second most common in Black patients. Squamous cell carcinoma. It's the second most common type of skin cancer in non-Hispanic whites, Latino, Hispanics, and Asians, but the most common type of skin cancer in Blacks, as well as our transplant patients. And transplant patients are generally taking immunosuppressive medications so they don't reject their transplant, which makes them higher risk for this particular type of skin cancer. And melanoma, luckily, while more rare than basal cell and squamous cell carcinoma, is the one that's more likely to be dangerous, and that's what we'll spend the most time talking about. I wanted to briefly show some photos of what basal cell carcinoma can look like. So here's a photograph of a basal cell carcinoma on the nose. You can see it's kind of a shiny pink bump with some little erosions in it. These can be tender and can bleed. Here's one kind of hiding in a sideburn, but you can still see a little bit of that shiny pink. They don't always have to be pink, so sometimes they can have more browns and blacks in them. But still a kind of a shiny papule. For patients that are a little darker in skin color, it's actually much less likely to be pink, and it can be, again, shiny bump, but more brown to black throughout the whole area. So that's what you'd be wanting to be keep an eye out for. And then again, a patient with even darker skin, you can see really more dark brown to black. Basal cell carcinoma, the most common risk factor for it is ultraviolet light. But you can see here I listed other more rare causes of basal cell carcinoma. And I think the biggest one to highlight here is transplant patients. So a lot of our patients that end up getting basal cell and squamous cell can be transplant patients as well. The distribution or where basal cell occurs is really on the head and neck, both in non-Hispanic whites as well as in our Latino, Asian, and Black communities as well. Moving on to squamous cell carcinoma, these often look more like yellow, kind of crusty bumps that can be tender and sometimes bleed as well. Another squamous cell carcinoma here. They can also appear on a lip. This was a Latino patient of ours who had a transplant with a little squamous cell carcinoma on the lip there. Again, for squamous cell carcinoma, most common risk factor is ultraviolet light exposure, but as we were hinting at, being immunosuppressed, such as having an organ transplant, really does increase your risk of these type of skin cancers. Interestingly, where these skin cancers occur can really differ based on the population. So in non-Hispanic whites, most likely to occur on the head and neck. In patients, particularly Asian and Black descent, more likely to occur on the lower legs and pelvis area. And that's because sometimes squamous cell carcinomas can occur in areas of chronic inflammation, such as kind of non-healing wounds or ulcers. And just because they're much less likely to have UV-induced squamous cell carcinoma, there's a higher proportion of these that occur on the lower leg. So based on the individual where this is located can vary. So let's move into talking about melanoma. So how common is melanoma? Luckily, as we talked about, it's more rare, and the majority of melanomas are induced or kind of caused by the sun. You can see in non-Hispanic whites, about 33 per 100,000 individuals will be diagnosed with a melanoma per year. In American Indians, just about 12 per 100,000. Hispanic Latinos, 5 per 100,000. And then close to 1 per 100,000 for Asian Pacific Islanders as well as Black patients. And so what does that translate to? Non-Hispanic whites are about 7 times more likely to get melanoma than Hispanic and Latinos, and about 33 more times likely to get melanoma than Black patients. However, when you think about outcomes or how well people do if they do have melanoma, this graph over here shows survival, and for ease, lower on this chart is bad, so that's bad outcome. And you can see for our non-Hispanic white patients, they actually have some of the best outcomes for melanoma. And then really when you look at our Hispanic Latinos, our Asian Pacific Islanders and American Indians, as well as our Black patients, the outcomes are not as good. When you look at the total individuals who die from melanoma per year, you can see that because melanoma is so much more common in our non-Hispanic white population, that really the vast majority of deaths are in our non-Hispanic white population. So although outcomes or the chance of having, bad things happen if you're Hispanic, Latino, Black, Asian American, Pacific Islander is higher, luckily the overall likelihood of that event happening is very, very low. So while we're really engaged at helping melanoma in all communities, good to know that it's really the non-Hispanic whites that are primarily having bad outcomes. So let's go over types of melanoma next. So really the way I like to break down melanoma is into two large categories. The vast majority of melanomas, as we were talking about, are caused by the sun. And to prevent these type of melanomas, that's where sun protection comes in. However, there's a subset of melanomas that really are not caused by the sun at all, and we'll also talk about these. These are often called acral melanomas. So let's first dive into the melanomas not caused by the sun, aka acral melanoma. And because they're not caused by the sun, they're not necessarily found in areas that you'd expect to have lots of sun exposure. And again, because they're not caused by the sun, really these melanomas are about just as likely to occur in non-Hispanic whites as Hispanic Latinos, as in Blacks and in Asian Pacific Islanders. So really anyone is at risk of these melanomas. Luckily, they're much more rare than the sun-induced melanomas, but they can occur in between the toes, on the bottom of the toes, on the heel. And you can see often, a larger brown to black, multicolored, multiple different shades of colors in these spots. And they're often fairly large, definitely bigger than a pencil eraser in size. And here's a few more on the heel and instep, just to give you an idea what these can look like. So multiple different shades of brown and black. Another one here on the instep as well. So these are the acral melanoma variant not caused by sun exposure. They can also occur underneath the fingernails and underneath the toenails as well. So other places to keep a lookout for, particularly a straight band of black or brown is something to keep your eye out for. And you can see for this melanoma here underneath the toenail, it's actually started to grow out onto the skin underneath the toenail as well. And this one, a little bit more subtle, you can see there's starting to be a little bit of pigment on the cuticle. And so it's starting to grow out onto the cuticle over here as well. So let's shift gears and let's now talk about melanoma caused by the sun. So these type of melanomas, really the people at risk for these are people that are going to sunburn. And let's talk about risk factors and drivers. Really the biggest risk factor is ultraviolet light. So whether that's natural light out at the beach or other sunny climates, as well as tanning beds, are really some of the big risk factors for sun-induced melanomas that you'll find kind of on the face, the neck, the trunk, and the arms and legs. And when you think about risk factors for melanoma, there's several subtypes. There's ones that you can change and there's ones you can't change. So the ones that you can change and help decrease your risk of getting a sun-induced melanoma is how much sun exposure you have, avoiding blistering sunburns, making sure to really protect yourself when you're at high altitude climates, particularly sunny high altitude climates, and avoiding using tanning beds. Things that you can't necessarily change that are risk factors for sun-induced melanomas is light hair color, such as blonde or red, light skin color, a family history of melanoma, and natural light eye color such as blue. So really the people at highest risk for these sun-induced melanomas have lighter colored skin, blonde or red hair, and light colored eyes. Another risk factor is just how many moles you have and how odd your moles look. So this individual has lots of what we would call atypical moles or dysplastic moles. And so if you're an individual who has lots of moles, particularly lots of moles of different shapes and sizes, that would also increase your risk for these type of melanomas. So we'll quickly go over how to protect yourself from the sun. And really, there's multiple different things you can do to protect yourself from the sun. First is avoiding sun exposure between those peak hours that the sun is highest overhead. That's between 10 a.m. and 4 p.m. Wearing a wide brim hat, wearing sunscreen that's at least 30 SPF in broad spectrum, which means protects both against ultraviolet A and ultraviolet B, so UVA and UVB. Wearing sunglasses that block UVA and B as well. Of course, being in the shade is better than being in direct sunlight. And then we always advocate for using sun protective clothing with UPF in it. Sunscreen works well, but sun protective clothing always seems to work just a little better. When you think about sunscreen, there's two major types of sunscreen. There's physical or mineral-based sunscreen, and there's chemical-based sunscreen. There's really pros and cons to each of them, and I listed them below, so I don't need to go through them point by point. But really what we recommend is whichever sunscreen works for you better. At least 30 SPF, and if it's broad spectrum against both UVA and UVB, then from our standpoint, that's the right sunscreen for you. Let's next go through the A, B, C, D, E's. These are different criteria you can use to help see if a mole looks atypical and may be a melanoma. A stands for asymmetry. So how does a mole look side to side or into quarters, if you split into quarters? And you can see on the right side of the screen here, these are just benign, harmless moles. And on the left side, these are melanomas. And so you can see those moles look pretty symmetric side to side, while the melanomas, there's all kinds of asymmetry, both in the shape and in the color. Next is irregular borders. So normal moles often have pretty regular borders, whether it's more of a circle or more of an oval for those harmless moles on the right. On the left here, we got these melanomas, and you can see when you draw a border around them how irregular it is and how many nooks and crannies they have. So those are things to be on the lookout for. C is color. So how many different colors or shades of colors are in a spot you're looking at? You can see the moles are often either one color, or this upper mole here really has maybe two colors in it, more of a brown and a light tan around the outside. But you can see the melanomas really have several different shades of brown and dark brown to black in them. And so that's what you're looking for. Next is diameter for D, and really 6 millimeters here in the US, we don't really think about millimeters that much, but 6 millimeters is about the size of a pencil eraser, also about the size of the diameter of an Apple pencil, in case we don't use too many pencils anymore. So that's about the size you're looking at. Is it going to be bigger than that? You can see the moles, although zoomed up, they're relatively small in size, but those melanomas, they are quite large, quite a bit bigger than the size of a pencil eraser. And then lastly, E is evolution over time. So is the spot changing over time? And this would often be over a period of months to maybe 6 months to maybe a year. So, that's a timeline to be looking for changes over. Another way to think about it, instead of thinking about A, B, C, D, E and having to remember each one of those points, is just think about the ugly duckling. So, here is a patient. And when you look at their back, they have multiple moles, but that one the arrow is going to, you can see kind of stands out. It's a little bit bigger than the rest of their moles. And even from this further away look, you can tell that there's some irregular borders and multiple different colors in it. And so really just kind of that gestalt view from afar, which one just really doesn't look like the others, that might be a spot to get checked out and have looked a little bit more closely. So next, let's talk about self-skin exam, how to look at yourself and prevent or find skin cancer early. So generally best to derobe in front of a full-length mirror. And while facing the mirror, you can look at your face, your neck, your ears, your chest, your belly, under your arms. Then facing away from the mirror with a handheld mirror, you can look at kind of the back of your scalp, the back of your ears, the back of your neck, your back, your buttocks. If you have a partner, this is a great time to let them look at these areas because it might be a little bit easier than having you look at them through two mirrors. Then when you sit down, you can look at your thighs, your knees, your shins, the top of your feet. And then again, with a handheld mirror, you can look at the back of your legs, your calves, and the bottom of your feet as well. So what do you do if you find something suspicious? We always recommend taking a photograph of it, then making an appointment with your primary care doctor or your dermatologist. And remember, catching a melanoma early can be life-saving. And so the last question I wanted to discuss before turning it over here is do I need to get skin cancer screening? And really, I'd say it depends on who you are. So if you're, part of the general population without any of those risk factors that we talked about for melanoma, likely you're low risk, and just taking a look at your skin yourself every 3 months or so would be a good way to kind of just monitor things. If you're moderate risk, say you're an individual with red hair, light colored skin, you've had a lot of sun exposure in your life, or maybe a family history of melanoma, that's an individual that should be taking a look at their skin every 3 months or so, but also consider either seeing your primary care physician or maybe a dermatologist for skin checks periodically. If you're a higher risk population, this is an individual with a personal history of melanoma, or maybe they have lots of atypical moles like that photograph we showed earlier today, then taking a look at your skin every 3 months plus seeing a dermatologist is likely the best move. And then those individuals that are really high risk, say they have multiple previous melanomas, or there's some different genetic syndromes that make you more likely to get melanoma, those are the individuals that should probably be checking their own skin, but also seeing a melanoma specialist. So is that, I wanted to go ahead and thank Manal again for the opportunity to present today. And if there's any questions, I'd be happy to take those.
Thank you so much, Dr. Costello, for providing this valuable information to our community. As you said, the Q&A is open for Dr. Costello to answer some questions. So I see we already have one. So are there any skin cancer risks associated with gel manicures? Gel manicures use UV light.
Yes, that's a great question. The short answer is there's not great research data linking the UV light to skin cancers, particularly on the nails. If a skin cancer was to occur, it'd be more likely a squamous cell carcinoma, not a melanoma, because the melanomas that occur underneath the fingernails actually are not thought to be induced by sun-related mutations. That being said, the AAD, the American Academy of Dermatology, does recommend to be on the extra safe side before getting gel manicures to consider putting sunscreen just on the back of your fingers and the back of your hand. If you do that about 15 minutes before having the UV exposure, you should ensure that that squamous cell carcinoma risk is very, very low.
Thank you so much, Dr. Costello.
Of course.
And I'll give us a little bit more time just in case someone else is typing something. Okay, thank you so much, Dr. Costello. And if we don't have any more questions, oh, I think I jinxed it. Okay, so how can people of color prevent skin cancer?
Yeah, it's a really good question. So if you have a darker skin and you're less likely to burn, really your risk of sun-induced melanoma is very low. We're still doing research on acral melanoma. It's more rare, so it's been taking more time. But as of now, we don't know of anything that particularly is the cause of it, and therefore we don't necessarily know of anything we can do to prevent it. Right now, the best thing we know to do is to know what it looks like and try to discover it early before it has time to grow too big. So probably the biggest thing is not necessarily it's not necessarily sunscreen or anything like that, but really just making sure you find it early. And it looks like we have another one. Does sunscreen recommendations? Yeah. So if you have darker skin, does it make sense to use sunscreen? It's another good question. So there's been several different studies looking at using sunscreen to prevent particularly melanoma in people that don't really burn. And the data has not shown that it decreases their melanoma risk. And that's predominantly because the melanoma risk is already so low. There is some thought that using frequent sunscreen might just decrease essentially skin aging. So cosmetically, there might be benefit to using sunscreen just to making yourself look young for longer. But for skin cancer prevention, unless you have, like, say, a transplant or immunosuppression or some other risk factors, you might not get large returns by wearing sunscreen on a daily basis, particularly if you're just trying to prevent skin cancer and melanoma, just because that risk is already so low.
And I'm not sure if you touched on this, Dr. Costello. We had a question about types of sunscreen recommendations for people of color. Sometimes we've noticed that the sunscreen will streak on darker skin tones and may not work as effectively.
Yes, yes, yes. So there are starting to be some companies that are creating different sunscreens with multiple different shades, so they blend in a little bit easier. I don't want to say I'm particularly endorsing any company, but I think Supergoop has been making a few of these different ones. I want to say Neutrogena is planning on bringing out a line, and so I think using these sunscreens that help blend into your skin tone a little bit better would be advantageous. And then difference between SPF, say 15, 30 or higher. So the difference between 15 and 30 is actually pretty large. 15 does not protect your skin anywhere near as much as 30 does. But the difference between 30 and 50, or say 30 and 100, is actually not that big. So generally we recommend at least doing 30 or higher, but there's not a huge recommendation to say do 50 or 100 instead of 30 SPF. But 15 does not seem to give you the same type of response as at least 30 does.
Wonderful. Thank you so much, Dr. Costello.
Yeah, of
Those are
course.
some great questions. Okay, so we'll go ahead and move on unless something else pops up. So now we're going to go ahead and begin our panel with our Pool Cool evidence-based initiative. So we'd like to welcome Autumn Kappes, who is the executive director of the Rochester Swim Club in Minnesota, and Miss Lolita Thomas, who is the VP Board of Directors for Calvary Life Center in Florida.
Hello.
Hello, thank you so much for joining us. So our first question today is going to be, how did you get involved as a community partner for the Pool Cool program?
We got involved when we were reached out to about the outdoor pools that we run by Manal, and then that's kind of how our journey started.
Okay. For me, with the Calvary Family Life Center, I got involved. I serve right now as one of the board members on our Community Research Advisory Board, and had several of the Mayo Clinic representatives to visit our Family Life Center and saw the indoor pool with the program. And then they offered up the opportunity for us to share and educate people about the Pool Cool program. So I thought it was very exciting.
Wonderful. Thank you both so much. Our next question is, what motivated you to participate in the Pool Cool evidence-based intervention? Autumn, you can go first.
My motivation was just my story. And so it was something that I had been on the lifeguards about all the time as the sun safety. And I felt like this was a great program to get out to more people in the community.
Lolita?
Yeah, my sentiments are pretty much the same as Autumn. I thought it was very helpful to be able to educate and bring awareness and promote the sun protection. I also reached out to our county, who has an outdoor pool for the community, and offer swim lessons, and got them engaged as well, so that we could definitely make sure our community gets the understanding and the knowledge to make sure we're protecting our skin. Because here in Florida, we have a lot of sun, we have a lot of beaches, we have a lot of pools around. So I thought it would be very helpful to educate.
Thank you so much. Our next question would be, if you could please, in your own words, describe what the Pool Cool program encompasses, basically a little overview of what this is, so we can explain to our audience here today. Autumn, would you mind going first?
Sure. For us, we have a social media presence, and so we have statistics and kind of little fun Canva things going out on all of our social media. And then we also incorporate it into our swim lessons instruction. So they take a few minutes at the beginning of the classes and talk to the kids about, how important these things are. Um, we also have the events right at the pool, and we do the city does a passport thing where kids usually are on a scavenger hunt kind of throughout the city. They do it to answer questions around the pool, and it's based on the literature that we have around. So we have banners, we have signs in all the locker rooms and restrooms that the kids can find the answers to, and then they get these sun safety prizes. It's pretty great.
Thank you, Autumn. And Lolita, if you could share next.
Awesome. I'm glad to hear what Autumn. So we're in the very beginning stages of implementing the program. We have a training session coming up May 23rd with both directors of both the pool at the Family Life Center as well as the pool at the county. So we're looking to implement and have those same type of activities for the youth in the community.
Perfect. Thank you so much. That kind of flows into our next question. I'll let you go first, Lolita. What do you have planned for the 2024 session?
So for the 2024, as I stated, the kickoff, definitely implementing all of the activities, starting out with the training. We have a big summer camp program that's coming up that will run from June to July, where we're looking to implement those activities. The camp will be held at the Family Life Center, so that's very helpful, so that we can do the activities, as well as the county pool will be hosting swim lessons and open pool time during the summer as well. So we're looking to implement the activities there. So we'll be very busy over the next few months in engaging the community with the Pool Cool program.
Perfect. Thank you so much. And Autumn, what do you have in store for 2024?
Well, we have a new water park opening on June 1st that is pretty big. And so we're going to have more availability of more space to put more of the literature out and more of the things out, especially we run a lot of free community lessons. That's been new in the last couple years. And so we're targeting times that those lessons are going on so that we can educate them then, as well as during open public pool time. We're also adding wall dispensers to make it more convenient. So as they exit into the pool area, instead of having to slap it on all over just with your hand, they have dispensers that they can use, kind of like soap dispensers, but they're right on the wall, and it just makes it a little easier, and they literally have to walk past it to go out the door, so that way they're more likely to use it, hopefully.
Wonderful. Thank you so much. And so our last question will be, what is the key takeaway you would like for your community to take from the Pool Cool intervention? And I'll let you go first, Miss Alita.
I would like and I see I do have a few people on the Zoom with me today from the community, but what I would like for the community to take back is skin protection. Let's make sure that we're doing everything that we need to do to apply that sunscreen as we're out enjoying the sun. Here in Florida, again, the sun is always beaming, and we like outdoor activities. So definitely protect yourself from the sun.
Wonderful. Thank you. And Autumn?
Yeah, the same thing. Mostly getting people to be more aware of what they're doing and having that sun protection all year round. We in Minnesota have very few months that we can be outside in the sun. And so when we do, it seems like a lot of people go for the burn to get, past it and then have their tan for the few weeks. We're trying to incorporate that that's not a good thing, especially as my own children become teenagers. It is a topic that comes up all the time now. And so especially these kids learning at such a young age is such a good thing, because then they're just in the habit as adults.
Thank you so much, Autumn. So this concludes our panel discussion. Thank you so much, Lolita and Autumn, for your time and your contributions to this discussion. We would like to now open it up to questions. So please utilize that Q&A chat feature and we'll get to your questions. Okay, it looks like we have a question. So what is the most effective way to treat a blistering sunburn?
Maybe we'll have Dr. Costello answer that since he's still on the call.
Yeah, good question. So, ideally trying to use sunscreen and sun protective clothing to avoid that blistering sunburn in the first place. However, if it does occur, you know, yeah, if you're not allergic, some people use aloe vera kind of creams. You could use probably over-the-counter hydrocortisone to help calm things down as well, hydrocortisone cream. It'll just probably more than anything just take time for the skin to kind of recover and grow out a new layer.
Thank you so much, Dr. Costello. I'll give us a little bit more time just in case any other questions pop up. And while we are waiting, I'll just go ahead and talk about what we have here on our screen. So on the screen, you'll find a resource that you can screenshot for your future reference. And this right here on our screen is going to help us select the right sunscreen, kind of what Dr. Costello described earlier. 1 in 5 Americans will develop skin cancer in their lifetime, so protecting our skin from the sun is extremely important. And this document will help us choose the right sunscreen for us.
Great. Again, thank you so much, Autumn and Lolita, for sharing about the Pool Cool initiative. We're so excited to be working alongside you to continue to raise awareness on how to reduce the skin cancer burden and increase prevention measures in our communities. By now, hopefully you have started to think about other ways to get involved in our Mayo Clinic initiatives. And so on screen, you'll find the flyer for our upcoming Pool Cool outreach events here in Minnesota. We encourage you to screenshot this and to join us at these events if you're in the Midwest. And we'll leave this up here for a couple of minutes as we answer some of these questions. I see that there is a question about the slides. If you're specifically referencing to the slides provided by Dr. Costello, I believe we could send a PDF form of those slides. Would that be okay, Dr. Costello?
We may have to run it past our team just because they have patient images in them. So I imagine, I don't know about the patient images if they can be shared more widely, but at a minimum, we could probably take out the patient images and share the text. We'd have to check on that.
Thank you, Dr. Costello. And we can also share some of the resources in our slides with the community. We'll work on that offline and get back to you on that question. So if you've registered for the Zoom webinar, we do have your contact information and can follow up from there.
And I see there's a question too about sunscreen and being acne prone. And at least I think it's regarding sunscreen. And for teenagers or anyone really prone to acne, you would recommend using a sunscreen that either says non-comedogenic, which means doesn't create pimples on the face, or a sunscreen that says like oil free or like low oil. Those generally are less likely to cause breakouts than other sunscreens. One thing just to be aware, a lot of times those non-comedogenic or no oil sunscreens might not be sweat and water resistant, so they might not be the right choice if you're going to be in the pool or doing a physical activity, but they might be a good choice to use on a daily basis as part of your daily sun routine.
Thank you so much, Dr. Costello, for that clarification. And again, we would like to say thank you to our community partners, Lolita Thomas with Family Life Center and Autumn Kappes with the Rochester Swim Club. Thank you so much for your time today. As we wrap up this conversation, please take a few minutes to complete the post survey to help evaluate how much you've learned today about skin cancer and melanoma. So we'll keep this up here for a few minutes. You can either use your phone to scan the QR code, or Nicole has placed the survey link here in the chat as well. And just to answer that previous question about the slides, one thing we do with this presentation is we do put it on YouTube. And so within a couple of weeks, there will be a YouTube link available to this presentation. We will always share that here with all of our participants. And then you can always find that on the Mayo Clinic YouTube page if you're interested in viewing any of this material again as well. Again, thank you to all of our speakers today for sharing your stories. Thank you to the audience for sharing your time with us today. And thank you to our Mayo Clinic team who helped make this cancer conversation happen. We'd like to remind you, you have to be your own advocate, be your family's health advocate, recognize the symptoms and the signs, and get screened. Be well and continue to thrive. Thank you all again for joining us today. Enjoy the rest of the day, everyone, and take care.